Hi guys, I'm starting with the cranial nerve 10, which is the vagus nerve. It's a mixed sensory and motor nerve. So let's start with the sensory first. So the first one is general somatic afferent, and afferent, as you know, it is sensory and it is somatic, so it's mainly conscious. It is general, so it is not a special senses. There's two different areas that you can see it. One is the pharynx, larynx, and external ear. Concha is part of the external ear. So the receptors are located here, and the cell body is in the inferior vagal ganglion, and then it's not shown here properly, but that goes there and to the spinal trigeminal nucleus, which process mainly pain and temperature sensation. There is also receptors located in the posterior cranial fossa. The meninges are covering that area, so that again it is mainly pain in that area. The sensation of pain coming from that area. The cell body is located in the superior vagal ganglion, and that is connected to the spinal trigeminal nucleus. So this is the first order neuron, and this is the second order neuron, and from there it goes to the thalamus, and the thalamus is the third order neuron that's located there. As we talked about it before, VPM is getting sensory information from the face, and VPL is getting sensory information from the rest of the body. And from the thalamus, then it goes to the parietal lobe of the cerebrum, and then you can feel the sensation. So this another one is still we are in the sensory. So this is the next slide. So general visceral afferent. So this is from the organs. There's two different areas. One is the thoracic organs and the abdominal organs, and the sensory receptors are coming from there, and the cell body is located in the inferior vagal ganglion, and from there it goes to the solitary nucleus, which is located in the medulla oblongata. Because it is visceral, so that goes to the reticular formation, which is in the brainstem, and then it goes to the hypothalamus. There's other receptors located in the aortic arch, which is baroreceptors for pressure, for blood pressure, and chemoreceptors, which is important for giving information about the amount of oxygen and blood pH and carbon dioxide. So those receptors get information, and then it is going to the inferior vagal ganglion again. The information is not processed here, it's just getting information, and the cell body sends it to the solitary nucleus, and the solitary nucleus send information to reticular formation, and from there it goes to hypothalamus. So the same pattern is there, that sensory information from the visceral organs, so subconscious sensory information gets to the solitary nucleus, and from there it goes to the reticular formation and brainstem, and then to hypothalamus. So it does not go to the thalamus, because thalamus is for somatic sensory. The other part of the vagus nerve is the motor component. So this is a special visceral efferent. If you start here, the E is the efferent, so efferent is a descending pathway, which is motor, and the word visceral, which mainly mentions visceral organs, but in this case it's not actually the visceral organs, it is the embryonic origin of those organs, which is the pharyngeal arches. So the pharynx and larynx are originated from the pharyngeal arches, so that's why the name is a little bit different. So the one of the component of the motor is a special visceral efferent, which is supplying the pharyngeal and laryngeal muscles. These are the conscious motor activities, and it's coming from the cerebral cortex, from the frontal lobe. that goes to the nucleus ambiguous. So cerebral cortex is this upper motor neuron, and nucleus ambiguous is the lower motor neuron. And from there, these fibers goes to the pharynx and larynx, and the pharynx and larynx are responsible for swallowing, and larynx which is for production of voice or vocalization or a speech, whichever you call it. Another thing is, I just put it here in the box, is coughing and vomiting. So coughing and vomiting reflexes also are initiated in this area, in the pharyngeal and laryngeal areas. So nucleus ambiguous is carrying motor information, and it is connected with cranial nerve 5 and solitary nucleus, which they are getting sensory information. So all the reflexes has a sensory part and a motor part. So the motor part is provided by the vagus nerve, and the sensory part is provided by the trigeminal nerve, and also by cranial nerve 9, so glossopharyngeal nerve. The other part of the motor is general visceral efferent. So efferent again is the descending, which is the motor, and visceral is the organs here. So it's not a special, this is a general visceral efferent, which is the autonomic nervous system. If you remember, autonomic nervous system has sympathetic and parasympathetic, and here is the cranial nerve 10 is carrying parasympathetic innervation to the organs. So here is the thoracic and abdominal organs are receiving information from cranial nerve 10. So the nuclei are a little bit different. For the heart, the nucleus is nucleus ambiguous, and for the lungs and abdominal organs is the dorsal motor nucleus of vagus. So these two are the lower motor neurons, but upper motor neuron, it is at subconscious level, so it's not cortex of the brain, but it's some other areas. So the hypothalamus, mainly hypothalamus, and reticular formation is for most of the organs. Olfactory, which is part of the limbic system, that is for the gastrointestinal system. Nucleus solitarius, which are solitary nucleus, this is the one that receiving sensory information from different visceral organs. So in this case, the gastrointestinal system and the cardiovascular system are the important ones that are receiving information, and it is giving supply to these organs in the abdominal and the thoracic area of the body. The recurrent laryngeal nerve, if you look at this around here, so it is a part of the vagus nerve, one of the branches that goes under the aorta and going up, and that supplies the laryngeal area. And if that area is damaged, then the person is getting hoarseness, so hoarseness of the voice. The dysfunction of the cranial nerve 10 depends on the area that is involved. So dysphonia, this is the area for the larynx, that the person has a difficulty talking properly. Dyspnea, the P is usually not pronounced. This is shortness of breath, so the person has problem with diameter of the bronchi and the trachea, so this is why the person has difficulty breathing. Tachycardia is that normally the parasympathetic system is reducing cardiac activity, and if that is damaged, then the sympathetic system is taking over, and the person has shortness of breath. Dysphagia, because the esophagus is supplied by vagus nerve, and then if it's not working, the person has difficulty swallowing. And constipation is again the damage of the vagus nerve in the abdomen. Normally the parasympathetic system increasing gastrointestinal activity, and in this case vagus nerve is not working properly, and the person has constipation.